morning. I'm going to talk to you about Bausch & Lomb. It's a company, a bit about its history, a bit about what we do in Waterford in terms of research and development, and a bit about some of the thought processes that go behind developing a new contact lens in Waterford. So Bausch & Lomb is a company that's over 150, over 160 years old. It was founded by two German immigrants in upstate New York, and originally started as an optics company, developing eyeglasses and eye frames, and progressed from that into a wide range of optical products, from microscopes to binoculars to cinemascope lens for the cinema industry and so on, and developed and commercialized soft contact lenses in the early 1970s. And that product was very successful, and sufficiently successful that they looked to have an overseas manufacturing location for the contact lens production. And they came to Waterford in 1980 and made the first contact lenses in 1981. Since then, we've been in almost a continuous expansion mode, where we now make hundreds of millions, if not billions, of lenses in that time, and we're now the center for Bausch & Lomb for all of the daily disposable production for the corporation. And we continue to expand in more recent years. We had an official opening last July of a significant extension of our building that brings us to over 500,000 square feet, 50,000 square meters of manufacturing space and research and development space. And we keep increasing the number of employees, but significantly we're doing that because we're growing the market. Our new products are selling very effectively for us. We're actually putting in significant automation that's reducing the labor content of our products, but we're actually employing more people because we're expanding our development, we're expanding some of the technical functions on the site, and that is growing our business. And one of the key successes, and I'll talk about it, is our daily disposable product called Biotrue One Day. Just to give you some idea of our facility in Waterford, we supply contact lenses to the world. Over half of what we make actually goes to the Asian market, mainly to Japan, but we're also a significant player, and we're actually the market leader in China for contact lenses. And in fact, some parts of China, Bausch is a generic term for a contact lens. We also supply back into the US and to the European region. So we're regulated by the FDA, the Japanese Ministry for Health, Welfare, and so on. So we have a comprehensive portfolio of products going to the world. And at this stage, we have done most of our research and development for those products manufactured in Waterford are actually developed in Waterford. We have about 45 people in our research and development group, a mixture of chemists, physicists, and various types of engineers. We have 4 laboratory areas. We have what we call our ADL, which is our Advanced Development Laboratory, which is where we manufacture lenses for clinical trials, for example, if we're in development mode. And what we want there is that the contact lens sees what it will see in manufacturing. We can only make a few hundred or maybe a few thousand. In manufacturing, they'll make the millions and the hundreds of millions of them, but we want what the contact lens sees, that bit of plastic that you're going to go onto your eye, is identical in our laboratories to what it is in manufacturing. We bring out new contact lenses, so there's invariably new materials going into those contact lenses. We have to develop the analytical methods that will eventually be transferred into manufacturing for our quality control tests. Our soft contact lenses are polymer materials. We start with a monomer and we have a reaction that goes on to make them into our contact lens material. So we have a monomer development laboratory where we can blend different combinations of our monomer components so that we can test those out in manufacturing. And then a key area for us is metrology, measuring a soft contact lens. If you take this Biotrue lens I'm going to talk about, it's 80% water. So there's not much, there's only 22% of material in that contact lens, and yet we want to put sophisticated optics into that clear material, and we need to measure those, and we need to have the technology to measure those. So we're at a stage now where 96% of the volume that we make in Waterford, which has 1,350 people employed, are products that were developed in the Waterford site. And to give you sort of a chronological history of some of those developments, the key point, the takeaway I want you to get from this is there's an awful lot more arrows coming down in the recent years than there has been in the past. We've significantly grown our research and development activities, and as we mainly develop daily disposable products, which are becoming more commoditized, we need to differentiate our products. So we need to come out with new and improved versions constantly to succeed in the marketplace. And in terms of a successful product, what do we have to think about? We have to think about the people that might want to use our product, why they might want to use their product, how they're going to use the product, and in terms of some of the other talks earlier this morning talked about what's mega trends that are changing in our world. People are using our digital devices a lot more than they were before. And that has an impact on our business in terms of the people using our products are using them in a different way than they have before. An example of that in terms of digital activity is people spend, this is from one survey that we participated in, 9 hours a day looking at digital devices. Many of you are doing it at this meeting today, that we constantly are looking at those digital devices. We're reading, we're watching TV, so there's a lot of digital impact. So we need to make sure that if we're giving people a new contact lens to look at the world, see it better, we need to make sure that they're going to see it better in the applications that they're using. And that, to a significant extent for people, is digital devices. And one interesting part is when you're using your digital device, you're not blinking as often as you were when you're just looking at, say, one of the stands here. That on average, people blink 15 times a minute. When they're reading from their phone or another digital device, they don't blink as often. They only blink about 5 times a minute. So that has an impact from the contact lenses that we develop, because you're not going to be blinking, you're not going to be lubricating that contact lens as often if you're using a digital device. So we have to consider that we develop materials that are going to be effective in a low blink environment. So our objective from our research and development activity, and it applies across the piece from a contact lens point of view, people wear contact lenses to see better. So it's for optical correction, but they also want the comfort and convenience of the product that they're using. And the eye care practitioner, the optometrist, is the decision maker of which contact lens you end up wearing. If you go to your eye care practitioner and look for a contact lens, they're going to hopefully give you the best product, but they do think about the speed of fitting. How long will it take you to adapt to this product? So it's important that our products are ones you can have ease of insertion, as we call it, to put the contact lens into your eye. Ease of comfort is very critical to our business. So these are some of the aspects that we look at when we're designing our clinical trials for a new product. So just as a case study of one of the new products we developed, and it's now a complete family of products, is the Biotrue One Day. And the inspiration for this is a product that's going to go in people's eyes. We want it to be as biocompatible as possible, and we thought about bio-inspiration as a model of what we need to think about. We all know the story of Velcro coming from the natural application. It's not a Velcro lens that we're thinking of, but that concept of being inspired by nature. How could we do things smarter, better for the patients? And what we came up with is your cornea is 78% moisture, 78% water in your cornea. If you want a comfortable contact lens, maybe we should try and make you a contact lens that's the same water content as your cornea. So there's no competition for water or moisture between the contact lens and your eye. So we did a lot of work on various materials to come up with a contact lens material that would be 78% water, same water content as your eye. Then the challenge you have is you don't want it to dry out. If people are in an air-conditioned environment, that water content could disappear over time. So we designed our polymer mix that we have what we call a lipid-like layer that at the surface is less likely to dry out the material. Similar to what happens with your own cornea. You have a lipid-like layer that stops it dehydrating too fast. We decided to put the same materials into our contact lens. Again, it has to have material properties to make it easy to use, easy to take it out of your out of your eye. And then we added, for an added potential benefit, is to put in UV blocking to lower the amount of ultraviolet light that's getting to your eye. It's not a replacement for sunglasses, but it does give you a reduced UV light exposure. And just an example of one of the tests we did to demonstrate versus two of our competitors how that drying out of the lens happens. That if you take a contact lens, just put it on the surface in a normal lab environment for 20 minutes, you can see that with some of the competitors, you get a total distortion of the lens. And this is a mimic, perhaps, of what might happen in an air-conditioned environment or a dry environment. While our product, because of the lipid-like layer, is even out in the open, it doesn't change its optics, it doesn't change its shape too much. Yes, it does lose some water, but in a more ordered, controlled fashion, which gives a benefit for long-term end-of-day comfort for the patient if their lens is drying out or their eyes are drying out, or they're not blinking enough because they're using a lot of digital devices. Then in terms of, again, people are wearing contact lenses for the most part because they want to see better. So you want to have the optimum of optics. And we've actually found that aspheric optics are better than spherical optics. And that again causes a complication from our point of view in that our metrology group then has to measure the amount of asphericity we put in. It's easier to measure a sphere, but if you deliberately are making it aspheric, that's an additional difficulty you have to overcome, but it has a benefit to the patients of reduced halo and glare, particularly at night. We need to understand how our eye operates. Particularly, we have products in this range that are for presbyopia, multifocal products, and we have products for people that have astigmatism, which requires a toric lens that requires a particular orientation. And you need that contact lens in your eye to keep its orientation. So you need to understand how does it interact with your eyelids. And most of us would have thought that your eyelid just goes up and down. It doesn't. What happens is your lower eyelid actually goes nasally, and there is actually a similar curve of, and this is what these bottom pictures are demonstrating. This is the lower, and these are the three other points on the eye in terms of we don't blink up and down, so we need to design our products for how people actually blink, not just for the theoretical. So we end up, for example, for astigmatism, a design of lens, and this is just, I'm not going to go into the details of the different components here, but there's a lot of technology, there's a lot of things we have to measure to deliver a safe, effective product to patients, and that's part of what the group in Waterford does. And then you need to go and find out, does it meet the actual customer's needs? So we do the surveys, the real-life surveys with various practitioners and patients. Do you get the consistently clear vision? Is it comfortable when you're looking at your smartphone or your tablet? Does it help to reduce your halos and glare in low light? So these are some of the activities that we end up getting involved in. We have the 45 people doing R&D in Waterford. We do have help from our colleagues around the world to do that, and more importantly, we then have to transfer that technology into our manufacturing site in Waterford so that we can make literally the hundreds of millions of that particular product. So you need that interaction from the clinicians to the manufacturing to the commercial people to make sure that not alone do we have a good product, that we're able to market it. So in this case, and this has been a significant driver to that expansion of several hundred new jobs in Waterford, the almost 200 million of investment in Waterford has come from the fact that this group of 45 people have developed this range of products called Biotrue, that it does give you that clear vision, which is the most important thing. It gives you the comfort. It gives you the stability that you need on your eye in terms of the optics, the ease of fitting for the optometrist, and it gives advanced innovation to people so that you have an effective, good product that works for the patients when they need it to work. Thank you. So hopefully that was a good overview about our company and what we think about in our development. Thank you for listening.